Does the thought of a needle make your heart race? Do you put off doctor's appointments just to avoid an injection? You're not alone. This is trypanophobia, or needle phobia, and it's far more common than you might think. Up to 63% of adults feel some fear of needles. And for about 5% of people, that fear is so intense, it stops them from getting essential medical care. So what is it? Really? Needle phobia is an overwhelming, irrational fear of medical procedures involving needles like vaccinations, blood draws, or even insulin shots. It's not just about being a little nervous. Symptoms can be intense, ranging from severe anxiety and panic attacks to physical reactions like a racing heart, sweating, dizziness, and even fainting. This is often caused by a vasovagal response, where your blood pressure suddenly drops. For many, this fear stems from a painful experience in the past, especially during childhood. In fact, a staggering 94% of people with needle phobia link it to a traumatic event. Other risk factors include a family history of phobias or a general hypersensitivity to pain. The impact of this phobia is serious. Over half of those affected admit to skipping necessary blood tests, and a third avoid vaccinations. This avoidance can delay diagnoses for serious conditions like diabetes or cancer, imposes a major public health risk. The emotional toll is huge, too. Yet 75% of sufferers never seek help, often feeling like their fear won't be taken seriously. But here's the good news. Needle phobia is highly treatable. Therapies like cognitive behavioral therapy or CBT have a success rate of 70 to 90%. CBT helps you reframe negative thoughts about needles and is often combined with gradual exposure therapy, where you slowly face your fear in a safe, controlled way. This might start with just looking at pictures of needles and progress from there. Exciting new treatments are also emerging, like virtual reality exposure therapy. VR programs can simulate a medical procedure in a completely immersive and safe environment, helping to reduce anxiety by up to 60%, especially in kids. While you're exploring professional help, there are things you can do right now to cope. Distraction is a powerful tool. Listen to music, squeeze a stress ball, or chat with the nurse during the procedure. Applying a numbing cream an hour beforehand can also make a huge difference. Don't be afraid to communicate your fears. Ask to lie down to prevent fainting, bring a friend for support, or request a smaller needle. Remember, your healthcare provider is there to help you. If you're struggling with needle phobia, please know that your fear is valid and help is available. Talk to your doctor or a mental health professional. Taking that first step can open the door to better health and peace of mind. Thanks for watching, and don't forget to subscribe for more helpful content.